All right, everybody. Thank you for joining us today. Before we get started, I wanted to mention that Jessica Bunting is online from CPWR to handle any technical issues and assist as needed. If you are experiencing difficulties with WebEx or with your audio, just message her in the chat box or shoot her an email by responding to the WebEx registration or reminder emails. Should you lose audio at any point, please call in using your phone. The call-in information is listed on your screen right now and can also be found in the WebEx event emails. Jessica is recording today's webinar, and that will be sent to everyone along with a PDF of the slides in a follow-up email after the event. We're planning to save time, some time at the end for questions and answers. And we did receive a number of questions during the registration, and we'll do our best to get through as many of those and the ones we received live as possible. Please enter your questions in the Q&A box on screen at any time. So I am Chris Cain, CPWR's Executive Director, and I'm pleased to be joined today by Scott Earnest, NIOSH's Associate Director for Construction, and Chris Lengieza, Procore's Senior Director of Business Development. As mentioned in the announcement for this webinar, this is the first in a new bi-monthly webinar series on topics related to COVID-19. Today, Scott and I are going to give brief updates on COVID-19 related activities within our organizations, and then I'll turn the floor over to Chris, who will talk about an analysis his company has conducted of their internal data and what they learned about recent construction job site activity that can help industry stakeholders and economists analyze trends, debate potential courses of action, and decide on the best path forward as construction work picks up throughout the United States. So with that, I am going to go ahead and turn it over to Scott Earnest. Scott?
Hey, thanks, Chris, and thanks to everybody who has called in today. It's great to be able to participate and talk to you about COVID-19 in the construction industry. I also want to say thank you for all the great work you're doing to advance construction, occupational safety, and health during these very challenging times. We've had a lot going on in recent months to address the hazards of COVID-19 in the construction industry. And from my perspective, it's been really an all-encompassing and consuming effort. And as part of that effort, we've engaged with many different key partners and stakeholders in the construction industry. And as part of that, we've worked extremely closely with our NORA Construction Sector Council and a COVID-19 work group that we've established in the last several weeks. Also wanted to, again, acknowledge CPWR, the National Construction Center, for the very important role that they are playing in addressing this issue. And I also briefly just wanted to mention that the CDC guidance continues to be updated. So it's just, on a daily basis, there's various aspects of guidance available on CDC's website that is updated as we learn more and more about COVID-19 and its impact and ways to mitigate. So in terms of some of the things I wanted to cover in my brief update, just wanted to go through some of the basics of COVID-19, get into the symptoms, the ways it's transmitted. I wanted to talk about relatively new NIOSH COVID-19 construction guidance that's been published on the CDC website, as well as touch on other guidance, because there's actually quite a bit out there from many different reputable organizations. I wanted to talk about our sector council and its role in helping to address this for the industry, and then also touch on some web links that could be helpful to you all as you work through these issues. I wanted to start off by just mentioning that the approach to mitigating COVID-19 in the workplace is really based upon exposure control methods, and those exposure control methods are linked really quite closely to the traditional industrial hygiene hierarchy of controls. And I'm sure most of you are familiar with that, but if not, it's elimination, substitution, engineering controls, administrative controls, and then at the bottom is personal protective equipment. And in general, the most effective methods are at the top of the hierarchy, and the less effective methods are at the bottom of that hierarchy. And so that triangle on the right-hand side of the slide is a representation of the hierarchy. And so in terms of basics of COVID-19, COVID-19 is primarily a respiratory disease. So people that have COVID-19 have a wide range of symptoms ranging from mild to severe, and it can include fever, cough, difficulty breathing. However, in some situations, the cases can result in more severe symptoms and things such as viral pneumonia, or even affect the liver, the kidney, the brain, the heart, and the blood clotting system. So it can be really very, very dangerous and deadly. The incubation period for the disease is about a little over 5 days, and 99% of folks that get it will show symptoms within 12 and a half to 14 days of exposure. So you can get COVID-19. You won't necessarily be hospitalized, obviously, if it's a mild case, and some folks can have it and not even feel sick or really exhibit symptoms. One of the really important things in effectively mitigating transmission of this in the workplace is to really understand how it's transmitted. The best way to prevent the illness is to avoid being exposed to the virus. And CDC believes that the virus is primarily being spread from person to person between people who are in close contact with one another, or within about 6 feet. And so respiratory droplets are produced when an infected person coughs, sneezes, or talks, or even sings in some cases. There have been reports of transmission, in choirs at churches. But these large droplets can land in the eyes or the nose or the mouth of people who are nearby, or potentially be inhaled into the lungs. And then there's a couple other modes of transmission that are considered to be, significantly less of a mode than the, person-to-person and close contact. So one of those is by being transmitted by contact with a contaminated surface, or when a person touches an object that's contaminated, and then their hand touches their eyes, nose, or mouth. And then some recent studies have indicated that COVID-19 can be spread by folks that are not showing symptoms. And then lastly, the third mode is, and again, this is somewhat controversial, but the third mode is transmission by aerosol. And aerosols are very small, often micron-sized particles that can remain in the air for very long periods of time. I'm talking hours. Aerosols can easily be transmitted from person to person in the air, or even through building ventilation systems. And so there have been a number of papers published that indicate that could be a possibility as well. And if you look at the existing guidance that's out there in terms of how to mitigate COVID-19 in the workplace and provide a safe workplace for construction workers, there's primarily 3 different approaches to mitigation. The first one is physical separation and distancing. That can include things such as staying home if you're sick, screening workers if they arrive at the site. With construction sites, there's a lot of coming and going with subcontractors and contractors. So screening workers that arrive at the site, maintaining this distance of at least 6 feet. The second strategy is personal protective measures, and that can include such things as using proper cough etiquette, frequent hand washing, wearing of face coverings or N95 respirators or higher, and then lastly, decontamination of environmental surfaces. And so the next several slides that I'm going to go through are slides that come directly from the CDC, NIOSH guidance that's available on the CDC website for construction workers. And so this is the front page of that guidance. If you want to find it, you just go to the CDC website and type in, what construction workers need to know about COVID-19. And so the guidance begins with, what I just sort of talked about, how COVID-19 is transmitted. And then as you get into the information that's provided in the guidance for construction workers, it talks about how construction workers can protect themselves. And some of the things it recommends there is to notify your supervisor if you have symptoms, follow the CDC guidelines if you're sick, and for that matter, stay home if you're sick. Also follow the CDC precautions, and that's all spelled out on our website. If you have a sick family member in terms of isolation in the home, utilize social distancing, and then lastly, the recommendation of wearing a cloth face covering, and that's a recommendation that's sort of widespread now across our society for folks that are out in public. But CDC is recommending cloth face coverings, and some of that gets into the issue of just the fact that we have limited supplies of N95 respirators. And then as you get further into the guidance describes steps that the employer should take and things that they can do to maintain a healthy work environment. And some of the topics that are discussed under that section include providing accurate information about COVID-19, taking steps to reduce the transmission amongst the workers, minimizing face-to-face contact, proper hand hygiene, clean and disinfecting vehicles, tools, and equipment that are being used on construction sites, and then also maintaining a healthy work environment. And that gets into things such as modifying work schedules to minimize large numbers of workers being in close proximity to each other, avoiding working in confined spaces where possible or confined areas, or if you have tasks where you have to work closely with others, to be wearing cloth face coverings and PPE. Making sure you conduct a hazard assessment of the work site, and that there's somebody responsible to oversee all that, and then again the proper social distancing. And then the CDC guidance kind of wraps things up with healthy business operations, and some of the things that are touched on there again have deal with having a safety officer or an individual on the site, on each work site, that's primarily responsible for COVID-19 issues. Also encouraging the use of flexible sick leave, and I know this can be an issue oftentimes in the construction industry, but if folks are sick, allowing them to stay home so that they're not coming to the workplace and getting others sick. Also providing information on who should be contacted if you become sick, and then also staying in contact with local public health officials so you have a clear understanding if there are significant outbreaks in the particular community where the work is being conducted. And then just to wrap things up, I've got a number of web links here that could be useful to you. The very top one is the COVID-19 clearinghouse, and I know Chris is going to get into some detail on. That's something that our Sector Council work group has been working with CPWR and others to help populate. And then the CDC guidance for construction. There's CDC guidance for businesses in general, and then also for small businesses. There's the Directory of Construction Resources, the OSHA website, and then also the fact that if you just want to call somebody and talk to them, there is a 1-800 number for CDC. It's a CDC info number that you can call and talk. Again, I wanted to just call out our sector council, the fact that we have a work group established. It's being chaired by Travis Parsons with the laborers and Mike Mills at Liberty Mutual. There's a lot of great work going on there. And that is my update for the work going on with NIOSH. So I guess I'll turn things over to Chris at this point.
All right, Scott, thank you very much. Just going to queue up my slides, or if Jessica, you can.
You just have to advance for next. It'll be next. Or
all right, thank you. Okay, I'm not going to talk about the guidance that we've put out over time. I've done past webinars about those. We have them linked to our website on YouTube channels. What I did want to talk about, though, is the clearinghouse. We recently stood up a clearinghouse to try to collect information for the construction industry on COVID-19, a place where folks can go to get as updated information as we have just about working in construction in this epidemic. So this is the homepage of our clearinghouse website. The address is up on top. It's covid.elcosh.org, and it's a separate section that we've just completely built from the ground up to deal with this issue, to try to collect all of the resources, references, and information that we can find so that construction employers in the industry can best address this hazard. Here are the categories of things that we're putting in the clearinghouse. So it's guidance on workplace practices, such as procedures and recommendations, different plans, different written plans, things like that. Safety in action is a section that I thought was really important to include because there are a lot of challenges in construction to things like providing hand washing or maintaining distancing at choke points in construction, things like on elevators or personnel hoists, and on the points of egress and ingress to construction job sites. These are areas where workers are often in close contact, and some of the challenges of keeping distance is very difficult. But employers are finding ways to do it, so we're collecting the stories of actually how to deal with some of the challenges we have in our industry. We have a section on training and resources, presentations, toolbox talks, videos that we either have produced at CPWR or collected from trusted partners in the federal government and throughout the industry. Employer recommendations and requirements is a section for formal recommendations. We have issued what we call standards for U.S. construction sites with our parent organization, which is the North America's Building Trades Unions. That information is up on the clearinghouse. And also state and local requirements. We've found that a lot of governors, a lot of mayors, and other municipalities have put out specific information and requirements for those working in construction. So whenever we find those, we do our best to keep them current and link back to the states, especially when we have contractors who are working in multiple states and maybe under multiple sets of requirements. We felt it was really important to try to collect them all in one place. Also in here is research findings. We're trying to keep the industry apprised of research and data and reports that come out on ways that this virus is spread, on the impact of this, and on preventing things out of the literature as much as we can find. Fortunately, just about all the peer-reviewed journals are completely open access for COVID-19 related issues, so we're able to link right to the main peer-reviewed scientific reports for folks. Information on personal protective equipment, how to select respirators, how to select other PPE against COVID-19. And then we also thought it was really important to address this massive problem we have in construction. We have a disproportionate risk for suicide. We have a disproportionate use for a fatal opioid overdose. So mental health resources we wanted to include in the clearinghouse so folks could have a place to go and find resources that we hope will be helpful for the industry. Also, things like this webinar will be linking to our clearinghouse, and social media posts both from CPWR and some of our trusted partners to get more information that doesn't necessarily fit into the other categories. We need your help. This clearinghouse is not something that we can populate without the assistance of academics, of safety and health professionals, of construction industry unions, construction industry employers, and everybody. We're really looking for good stories. We're looking to find how people are addressing this issue, and we would love it if you would send it to us. We've set up a COVID-19 at CPWR.com email address just to receive this information. Please send whatever you can. You know, we ask for you to help us figure out if this is reliable information, if we have permission to post it. If you've taken a photograph of how you put a sink in where no sink ever lived before so that folks could hand wash, we'd love to see that and hear about how you did it so we can share the information and post it through the clearinghouse. And that is the conclusion of my comments. So I'm going to go ahead and turn it over to Chris from Procore to go through what I hope will be a very interesting presentation of the data and information that Procore has gleaned from its own data from the industry. Chris?
Thanks a lot, Chris, and really appreciate y'all letting me come and present some of the information and some of the findings that we've been able to derive from the data that we collect at Procore. For those of you who aren't familiar with Procore, we are a construction management platform with just over, north of 8,000 customers that use us on hundreds of thousands of projects across the globe. So given that information, we're able to glean some pretty interesting insights about how COVID has had effects on our industry, and mainly with the focus around how it has affected the number of workers and the number of worker hours that have been present on job sites throughout this pandemic. So just quickly, I'll give you a real quick kind of overlap of what I'm going to talk about. We'll talk about kind of the shelter-in-place timeline. That'll be really relevant to understand where some of these dips and valleys occurred in our data. We'll also talk about construction worker hours and how that as a whole, as an aggregate, as the United States was affected. And then we'll dive into some of the state-by-state results as well. And then what were some of the impacts on different business sizes and infrastructure. So as we talk about the COVID-19 kind of shelter-in-place timing, there were really 4 separate cohorts of the parts of the country that actually went into shelter-in-place at different times. The earliest being in early March around 3/15, early areas like California, Illinois, New York, New Jersey kind of went in really early. And then other parts of the country started to follow behind that as the weeks progressed from 3/15, 3/22, 3/29, and 4/5. Now, some of the states never actually put in place full shelter-in-place orders, and you'll see that those are designated as well. And where this will become really, really relevant is as we look at the state-by-state graph, you'll see how these different areas of the country are affected differently based on when their cohorts of shelter-in-place went in place, and also how this affected some of our national averages. Now, when we talk about construction worker hours, we talk about not just the general contractors or the specialty contractors. We're talking about all of those people that work on a job site. And the way that we're able to actually collect a lot of that information is through daily logs. Our customers could be owners, they could be GCs, they could be specialty contractors. But even if it's just them putting their information, they are also inviting all of what we call collaborators to the system. So that includes all of the tradesmen, all of the people that are working on the job site, any direct hire workers that are hired by the owners as well, and they will fill out a daily log on a regular basis. The one thing to note is that in construction, we've never really been great at doing those as timely as we absolutely should. So even though we are at kind of the beginning of June, our data takes about a week or so to stabilize after we come out of a week because of delays in inputting that data. So as you'll see here, as we were leading up to the COVID pandemic, we reached a pre-COVID peak the week of March 1st, which was about 14.5 million worker hours. Taking an average work week into consideration, that's about a representation of about 400,000 workers on a couple 100,000 projects that are taking place throughout the United States. As word started to spread about the pandemic and we were moving into that first shelter-in-place cohort, you'll notice that the numbers started to drop almost immediately. As that first shelter-in-place cohort went in place in the week of March 15th, we were already down 7% as worker hours. Now, as each of those different cohorts started to follow in line from the first to the second to the third and the fourth, we started to continue to see that drop in worker hours to a point where we were actually down about 17% overall from that pre-COVID peak. Now, a few things started to happen as we moved past that last fourth shelter-in-place order, in that we started to see some of the Payment Protection Act come into place. We started to see some of those payments get made. So we started to see a little bit of an uptick the week after that as people felt a little bit better about keeping their people at work. we started to see guidelines come out from the CDC and from local municipalities about how to keep job sites running. So companies became a little bit more comfortable about getting workers back to work. Different regions were relaxing the restrictions on their essential construction orders and what could be considered essential and how many jobs they could keep working. And you'll see that as we've come past that point, we've started to grow out of that low, which really is pretty interesting to think that we were down about 17% overall in the total number of worker hours across the United States, which was definitely a blow, but it certainly was not a knockout punch. And we've recovered fairly quickly to get almost all the way back up to our pre-COVID highs. Some of that consideration being taken to place of a seasonal. There's parts of the countries that are coming into their construction season, and also with the relaxing and the ability for some of these job sites to open back up. Now, as we continued to look at the data, we also wanted to understand, were there different regions, were there different areas of the country that were affected more than others? So we started to graphically represent how different parts of the country were affected on a state-by-state level on the decrease in worker hours. And so what you'll see over these next few maps is that, almost immediately as California went shelter in place, they dropped pretty significantly, 12%, and then the following week all the way down to 26% down. And we started to see that there was a pretty significant decline in some of these either hotspots or some of these early adopters of shelter-in-place orders. Now, the following week, the week of March 22nd, was when California started to open back up a little bit and say, hey, some of construction is essential. We're going to let some of these job sites continue on. So you'll see that they already started to rebound a bit. But different areas of the country, such as the Northeast, were getting hit even harder because they were the hotspots for COVID cases. So they were locking down those areas. They were locking down more and more job sites. People were not going to work because they did not want to get sick or because the job sites were completely closed. And you can see at this point in time, Pennsylvania was down almost 79% on their total worker hours of workers being put in place. Now, as we progress throughout these next couple of weeks, you'll notice that some of the areas start to come back online. Areas such as the Southeast and the South started to come back a little bit earlier. They started to relax some of those shelter-in-place orders. They started to open up more construction as essential activities. And you can see that they start to come back online, getting closer and closer to those pre-COVID highs. Continuing on to the beginning of almost the middle of April now, we're starting to see some areas to actually start to exceed where they were pre-COVID, right? So some of this being seasonal, some of this being catch-up work, people putting more people to work on the job site to catch up from the work that they had been before. And then other areas of the country are still being pretty heavily impacted because the regulations on what they put in place on social distancing, the max number of workers on the job site, even though they are getting back to work, it is a slower process and they're not able to put as many people on the job site as they were before. As we continue to catch up to almost where we are today, where we're finding ourselves are that a good portion of the country is returning close to where we were pre-COVID. There are still the hotspot areas and the areas that are affected by those hotspot states, things like the New Orleans and Louisiana area, things like New York State and New York City, Massachusetts, a little bit slower to come back online. But very promising is states like Pennsylvania, who are one of the hardest hit in the country, returning back to their kind of pre-COVID high of that week of March 1st. Now, the next thing we had heard from our customers and from the industry was that small businesses were going to be significantly more impacted than the medium or large businesses. And we wanted to test that hypothesis. We wanted to understand, was that actually what would take place? And so we charted those numbers out and we segregated our customer base into those three groups, small contractors being $20 million or less, medium contractors being about $20 million to $200 million a year, and large contractors being more than $200 million a year. And what you can notice here is a few interesting details. Small businesses clearly were more hard hit by the COVID pandemic when it came to business operations. A lot of this is some of those projects were considered non-essential. Some of those projects may have just gone away completely on a smaller scale. We're also seeing that medium businesses were more affected early on than the large businesses, but they did start to kind of close that gap as we got past kind of that April 5th low. Reason being is it took them a little bit longer to put in place maybe the safety policies, and took them a little bit more to mobilize and kind of get in place some of the workflows that maybe some of those larger enterprise, large companies already had in place. So they were able to kind of close that gap. And both large and medium-sized companies are getting close back to that pre-COVID high as well. The other area that we had heard was, would project type make a difference? Was there going to be a difference between projects that might be infrastructure-style projects versus those who would be non-infrastructure, traditional commercial construction? So we took our project database and we classified those projects based on what we believed or what our customers had told us the types of projects they were, and put them into two buckets. And what we found is that COVID across the board affected pretty much all project types almost exactly the same. They all had a sharp decline. They hit that low around April 5th, and then they've kind of come back up together. Not one really separation between the other, between infrastructure and non-infrastructure projects. Now, the interesting thing here is we said, okay, well, maybe there was a type of infrastructure project that may be a little bit more resilient than the other types of projects that we'll see. And so we decided to segregate the data a little bit more into really three subcategories of infrastructure projects, those being transportation, that being healthcare, and energy as kind of the lower portion, or excuse me, the subcategories of those infrastructure types. And for a while, healthcare projects were staying a lot closer to the line, and they still have not seen the decline that transportation and energy specifically have seen since the pandemic hit. We believe that that bump of actually an increase in worker hours in healthcare projects is because we did have a lot of our customers that were working on the COVID conversion projects, turning arenas and stadiums and convention centers into hospital bays. And so they were actually putting more people to work in some cases than they had in other places, and weren't nearly as affected as others. But when you compare non-infrastructure to infrastructure, once again, it's pretty even. There's not the significant drop, but transportation, which is a little bit smaller of a sample size for us, definitely had a significant low, but we're seeing those people get back to work and actually accelerating past even some of the non-infrastructure projects as well. So overall, there's a couple of reasons that we have decided to share this data with the industry. One is we think it's really important for people to have real-time insights, things that are up to date as of a week or 2 weeks ago, and not have to wait, sometimes months or, at least a month at a time to get jobs reports. We were also able to segregate a lot of this data down into either state levels or even in some cases major metropolitan areas to separate them out and do some comparison based on the number of projects that we had. And this is all live data. So we are continuing to update this. We have a Procore COVID Insights page that you can see the link at the top here, where all of this information is updated on a regular basis. In addition, they did seem to, we've been adding new insights as well, beyond just the worker hours. We're looking at things like project starts. We're looking at things like number of bids, some of the indicators of what is to come in the future and how is that changing as we are responding to kind of the new normal. But if you have any questions about this, there's two ways to really get in touch with us about this. We have our community.procore.com community insights page. Feel free to go and join the conversation there. There are a lot of conversations about how contractors are dealing with this, best practices, technology tools they're using for it, best practices for their employees. Some of those similar COVID insights, articles and things like that are on our page, as well as some of the ones that were shown earlier today. And then if you have any additional questions about this data or you want to get more information, don't hesitate to reach out to us either at press.procore.com as well. So I'm going to go ahead and turn it back over, and I think we're going to open it up for some Q&A.
Yes, we are, Chris. Thank you so much. When we first saw the data that you have at your disposal, we were really interested in making sure other folks could hear the story that you can tell with your own data, and really appreciate your presentation. I do have at least one question for you that's come in so far. And just to remind folks, if you'd like to ask a question, please use the Q&A box or send a chat to Jessica at the host role. And I have a series that have come in from when folks registered. So I wanted to start with a couple of those. This question, let me just switch gears here because I'm trying to view different screens. This question is, I think Scott Earnest can answer this. The question is, how will the pandemic affect future construction activities when the suggestions from CDC are not mandatory? Job site restrooms, hand washing equipment, working alone, shared tools, close proximity team tasks, disinfection of equipment, etc. Scott?
Yeah, thanks, Chris. Appreciate that great question. My sense is that the pandemic is likely to have a lasting effect on the construction industry and really on our society as a whole. I mean, this is a once-in-a-lifetime event, really, or a generation. Many of the practices that have become recommended due to the pandemic are likely to just become more commonplace in the workplace. This includes more frequent hand washing, disinfection of tools and equipment on job sites, just general cleaning of buildings and facilities in general to prevent disease transmission, whether it's COVID or other types of diseases. And then also, I think, in some cases, working from home. So, for example, on a construction site, some of the admin staff, they may be able to work from home rather than having to go to an office or to the job site. We're all very well connected now, or much more connected now, it seems, than what we had been previously with, Zoom and, WebEx and, some of these other technologies that are becoming more and more useful for all of us. And the other issue is I just really don't think that COVID-19 is going to go away anytime soon. It's going to continue to be an issue. It could reemerge, on a seasonal basis, really until there's a vaccine that's been developed, or for that matter, if there's enough people that get it, that we start developing, what's known as herd immunity. So that's my feeling about the effect of this on construction in general. I really think it's going to have a lasting effect.
Thanks, Scott. And that does address another question that came in on the Q&A today during the webinar. I have to agree with you with the caveat that we don't know a lot still. We're learning about this disease. We're trying to develop, as a society, trying to develop a vaccine. We don't know a lot about immunity. And so there's a lot of questions that remain, and I think this is going to be with us for the long haul as well. So with that, I'm going to go on to another question. So there's a couple questions about respirators here. So one is, how are employers handling the shortage of respiratory protection? And related is, have respirator users been advised about respirator leakage, the size of the virus and its ability to pass through a mask or a respirator, as well as issues about fit? Scott, did you want to take the first crack at this?
Yeah, absolutely. Thanks, Chris. Another great question. I guess the first thing I would say about respirator use is, if respirators are being used on the construction work site, they need to be used in compliance with all OSHA regulations regarding respirator usage. So this means that they need to be in compliance with CFR 1926-103. And so some of the elements of that OSHA standard include having a written respiratory protection program, a medical evaluation of the folks that are wearing them, and then proper fit testing. You mentioned about the issue of leakage, and that's the reason why fit testing of respirators are so important, is to minimize leakage so that the air that's being breathed by the wearer is actually going through the filter media. Proper fit of the respirator is extremely important to make sure that it's performing at a maximum level. The other thing is that there was a reference to the small size of the coronavirus, and if you look at filtration efficiency, for higher efficiency filters, the most penetrating particle size is at 0.3 microns, and so that's the size of a particle that is can most easily penetrate through the filter. And as you get smaller, as the particles get smaller, as you get down to the nano size, generally the filtration efficiency increases due to collection by diffusion, and then the same thing with the larger particles. Those will the collection efficiency of the filter will increase as they get larger as well, beyond the 0.3 microns, due to impaction or settling. So that's some of the issues with proper fit of the respirators, making sure you're following proper following the regulations that are established by OSHA. And then the other thing I wanted to say about the shortage of respiratory protection is that that's one of the reasons why CDC is recommending cloth face coverings for not only construction but really most industries, is just because a big part of it has to do with the fact that we have a shortage of N95 respirators in this country, and so the highest priority is with healthcare workers, or it has been with healthcare workers, because of the the exposures that they're experiencing. And then I also wanted to say that some employers, if they are not able to get N95 respirators, are going to higher levels of respiratory protection. So if there's cases where workers have to be very close together, the workers are not comfortable with cloth face coverings and would prefer to have a higher level of protection, if N95 respirators are not available, there are higher levels of efficiency beyond N95 respirators that could be used. And then the other thing I wanted to mention is just CDC has provided guidance on how to decontaminate and reuse respirators. Now, that's not something that's normally undertaken, but given this pandemic and this really emergency situation we're dealing with, it is acceptable now. And so there's guidance that's been spelled out there about use of ultraviolet germicidal radiation, vaporous hydrogen peroxide, and moist heat to decontaminate respirators and reuse them. And then there's also information available on both the CDC and I believe the NIOSH website as well about using respirators from other countries. So like, for example, the KN95 from China. And if you go to the again to the NIOSH website, and if you look up NPPTL respirator assessments, there's actually testing that's been done on quite a few of these foreign respirators. That just went up a few days ago, but it gives you an idea because, quite frankly, a lot of the tests that are being used on foreign respirators it's different than what's being done here, and in some cases we found that they don't perform anywhere near as well as some of the American NIOSH-approved respirators.
Thanks, Scott. That's an awful lot of information. We've got so many questions. I wanted to kind of lump a few of them that we received with your registration information together. Unfortunately, we can't really speak perfectly to them. They're related to how do you determine if an infection is work-related or not. And for the OSHA 300 logs, how do companies determine whether if they have an infected worker they have to record it or not? What we'll do in the follow-up to this webinar is send out the links to the OSHA information, but we don't have an OSHA person on this webinar today. We hope we'll have one on in 2 weeks when we have our next webinar related to COVID. So right now, the best we can do is point you to the references that OSHA has issued on that. Another question is, will the construction industry be expected to self-regulate, or is there an expectation that contractors and GCs must undergo third-party COVID-19 best practices audits? And to my knowledge, I don't believe any government source has suggested that general contractors have to go undergo a third-party audit related to this. I think it's about identifying that we do have a recognized health hazard in our workplaces, and how are we going to control it. And with that, I'm going to go to some of the questions that have come in. I'm doing my best to track them as they come in from the screen that you see as well. We have a couple of questions related to masks and/or respirator use, and how do we deal with the increased potential risk when workers are working in hot environments. It's summertime and we're starting to heat up, at least on the East Coast today. So this is a very important question. And I don't know, Scott, did you want to take a crack at it? I can also.
I know that that's definitely an issue, that, and even if it's not a hot environment, there are people that just actually have, difficulty wearing respirators for, 4 hours, 8 hours a day. And so from my perspective, I think it's important to make sure that, folks that are wearing respiratory protection, or for that matter, even a face covering, have some breaks from the job that they're doing, so that they can, step away and cool down and, not become overheated. I mean, some of this relates to, heat stress issues and things like that. But, it's definitely an issue in construction. And as we get more, into the warmer summer months, it's going to continue to be an issue. So it's something to definitely, keep in mind and try to make sure that you, take care of your workers, that they drink plenty of fluids, and that's my general view of it, Chris.
Okay. Yeah, no, I agree. I think we have to keep in mind heat stress issues with added personal protective equipment all the time. We have experience in our industry, at least in some sectors of our industry, of workers working under heavy PPE that we need to kind of transfer to the rest of the industry, which does include staying hydrated and offering adequate breaks. And it is something that the employer will have to plan for as additional PPE is required due to the presence of this risk. We've gotten some questions that relate to a topic that we didn't really cover, in my view. And when we think about the hierarchy of controls for dealing with any hazard, you first want to eliminate the hazard. If you can't eliminate or isolate the hazard, you need to implement engineering controls. So some of the questions that have come in that really relate to potentially installing engineering controls relate to underground construction and tunneling. We have confined space work. Another question came in as far as mechanical systems of buildings. And I think all of this needs to be addressed from a ventilation standpoint. There's not a lot of guidance out there because there's not a lot of science yet on general ventilation and how this impacts. Although if we take information from the healthcare industry, new construction healthcare isolation rooms for respiratory patients need to have 12 air changes per hour. So we need to start thinking in construction, what are some enclosed spaces that need to have additional air changes, and how do we do that in a mobile work site? Obviously, I don't have all the answers for that. I don't know if I don't know if Scott can add if NIOSH is working on ventilation issues related to COVID-19 in areas outside of the healthcare sector, because they have done a lot in the healthcare sector.
So I guess what I would say to that, Chris, is there's a group, I actually spent a good portion of my career in it. It's the Engineering and Physical Hazards branch of NIOSH in Cincinnati that has a large number of ventilation experts. Ventilation is definitely an important part of the hierarchy of controls. It's actually much higher on the hierarchy of controls than use of PPE, which is at the bottom. And so when you think about COVID-19, one aspect of it is just outdoor air. So a lot of construction activities occur outdoors, and from COVID transmission, that's a really good thing. So if you're out, like on a highway work zone where you're outside, it's probably going to be a lot less likely to, have transmission on a site like that than if you're enclosed in a small room in a building where you're working closely with, several other construction workers. But the other thing is about ventilation. It's important if you use ventilation, the ventilation be designed. So you really need to involve experts in ventilation if you're going to apply that in buildings. The other thing is, if you're just in a large building where you're working, maybe performing maintenance activities on a building, there are things that can be done with the ventilation system to increase the airflow, to increase the amount of outdoor air inside of that building, and then also to potentially increase the filtration level to remove particles. So those are a few of my thoughts.
Those are great points, Scott. I want to throw one at Chris. Chris, the question came in is for the employment, or at least from your experience within your own data set at Procore, how does the employment levels or hours worked levels compare in the time range between February to May 2019 and 2020? Do you have any insight into that?
So
for the same months in those different years.
Yeah, no worries. There's definitely an increase. We were in a very strong market, so that lead up to that March 1st date was kind of a gradual incline over the last year in reality. And that's a combination of a few things. It is us kind of adding customers and projects, and there just being more going on in the construction industry. And secondly, also, that the economy was good. People were building more projects. People were starting new things, right? So we had not really seen any sort of a decline. It was pretty steady, gradual. Even in the off season, there were different seasons, different parts of the country going to work during those seasons. So it was pretty much a gradual incline up to there. We are actually looking to overlay some seasonality impacts to what's happening right now of coming back out of COVID to see how normally what would we expect the week-over-week growth or the month-over-month growth to be during this time of year, given that, hey, now's the time when a lot of people get to work and start a lot of projects so that they can be dried in parts of the country that will have a winter that won't allow them to be working outside as much.
Great. Thank you. There were a few questions related to what are the hot spots in construction? Are there hot spots in construction? Are there higher risk tasks or activities? And I don't think we know a lot about what's higher risk or what's lower risk. Some other questions about, are there actually construction job sites that are hot spots? Yes, Google it. We have job sites with a lot of sick workers or workers who've apparently become infected on job sites, some big job sites in this country. But there's a lot in the news report about that. So one of the problems we have in tracking this disease is that we have really weak surveillance systems for occupational disease. And we've been trying, a lot of people who are really interested to figure out what's going on in construction with this disease have been talking to everyone we can, from state health departments to county health departments to researchers to government officials, trying to figure out how we can have accurate and quick surveillance. So there's a lot of things in the work on that, but right now we don't know. Because if somebody has a confirmed case of COVID-19, there are questions on the case report form that's, what is supposed to be filled out for every one of those cases that ask if the person is in the healthcare industry. And those cases, that's the only thing we have on a national basis on industry and occupation. And so we're working on that on a lot of different levels and trying to get at the data and find out really what the incidence rates are in construction. We don't have those yet, but stay tuned. There is another series of questions on asymptomatic transmission. So Scott had mentioned that before you develop symptoms, you're pre-symptomatic, and sometimes people don't even develop symptoms. But yes, we do have data that asymptomatic transmission occurs, and that's why we're trying to protect everybody, even with the medical surveillance and monitoring programs that employers are putting in place to try to keep workers who are actively sick off of the job site so that they don't infect other workers. And I'm sorry to be rushing, but I'm trying to address as many of the questions as I can, and I'm not going to get to all of them. One question I thought, or one line of questioning that I've put together here is one person says they have a worker with a bad headache, or you have workers with other symptoms. How do we know that they're okay to come to work? And basically, the CDC says that you can, to release people from quarantine, it really can be done two ways, is with testing. So testing for the active infection through the, the nasal swab that you've all seen and heard about or perhaps had. But there's also a way to do it through symptom-based, figure out when you can essentially bring essential workers back to work. Those are some of the links that we will put in the follow-up email to some of that guidance that's out there from CDC. Basically, the advice that we're giving folks is that if you have someone who you know is positive on your job site, or or who has symptoms, that they should, number one, get tested, and you should work with your local health department to figure out if contact tracing and other activities have to be done on your job site. And then I wanted to just answer one more question and just shout out to Jessica, because I haven't followed ones that have come in the last 10 minutes, as I've been trying to get through as many as I can. One more question that I thought was really important is, how do we apply this for local companies or small businesses? And aside from posting some of the programs that we see that we think are going in the right direction on the clearinghouse, this is kind of a sneak peek. We're in the process of developing an online tool to build a program that would be free to use for everybody. An example of which is on our silicasafe.org website that we built for employers to develop a silica exposure control plan. We're in the beginning stages of building the COVID-19 exposure control plan, build the plan for this hazard, and we will likely be posting it through the clearinghouse website. And Jessica, I don't know if we have a couple more questions we can get to, or if we should wrap it up and try to get some more answers in the follow-up email. We still have a lot of people online, so what do you think, Jess?
Yeah, there's still a lot of people on, and we are recording. So if all of the presenters are available to continue for another 10 or 15 minutes, I think we're fine to do that. And if people need to drop off, you will receive the recording in a follow-up email from me within about a week.
Okay. So this is an interesting question. It says, why don't the panelists address the almost negligent impact of COVID-19 on the average age of construction workers, which is 20 to 40? It is more impactful on age and informed in construction industries, is medium to low risk for transfer. I would have to disagree with the average age that's posted. It's a lot older than that. And as of today, we have posted online a study where we looked at the risk factors for people who have higher incidence of severe disease from COVID-19 disease, and the risk factors that overlap the construction industry. So if you're not on our newsletter, if you are in our newsletter, it was headlined in the one that went out just before this webinar, and if you are not, I'd be happy to provide you with a link to that data brief that was just announced today. It's posted on our website.
Chris, this is Scott. One thing I would mention when it comes to folks that are at higher risk, there's a lot of information about that on the CDC website, and it gets into folks that are immunocompromised, older adults, people that have asthma, people with HIV, individuals with liver disease. So there's a whole list of groups of people that are at higher risk, and so additional precautions would be in order in those cases.
Excellent. There's a question here for Chris from Procore. It says, does Procore have an estimate of where construction activity would be had we not experienced the COVID-19 versus where it is now?
I don't know that we have enough data quite yet. So some of the things I can tell you that we are looking at and tracking very closely to try and understand where we're going and the impacts that this is having on the industry is things like project starts. How many new projects are being created? How is bidding changing? Are we seeing just as many projects being bid on a monthly basis? Are we seeing less? Are we seeing more? Similarly, how many people are bidding projects? What I can tell you anecdotally is I've been on quite a few of these webinars recently, and a pretty strong sentiment has been there are less projects bidding and more bidders on them, which it does seem to indicate that there's a little bit less work out there. I think that there's as we work with a lot of owners and developers as well, there's a sentiment of a little bit of wait and see. Like they're not canceling things completely, but they are certainly slowing down and waiting to see what's going to happen. So we don't have something that we're publicly ready to issue, but hopefully we will soon as we are digging into some of those details to see like, hey, where could we be going? How is this affected? What would we normally see this time of year on the pickup on the number of project starts versus what we're actually seeing today?
Thank you, Chris. There's a couple of questions here related to respirators. One is, with the shortage of N95 respirators, why aren't construction essential workers being upgraded to half-mask respirators with HEPA filters instead of cloth-based coverings? And I really like this question because, in my view, if workers have to be within 6 feet of each other, they should be in respiratory protection, and that respiratory protection should be at least an N95, which is the filtering face piece respirators that healthcare workers also need right now. So upgrading to a P100 filter on any kind of negative or positive elastomeric face piece respirator is, I think, what is needed when workers have to work in close proximity to each other in some of those tricky areas that we talked about earlier, until we can figure out how to properly ventilate workspaces so that the risk is reduced. Also, given the shortage of respirators, what are the expectations of having enough over the next few months? And I don't know, Scott, if you wanted to address this from what folks in NIOSH are saying.
I would really have to defer to our personal protective technology lab on that question. I can try to reach out to them and get information, but quite frankly, I don't have that at the top of my head. Okay,
thank you. Also, the question of, what are thoughts on face shield instead of face mask? I mean, the argument that CDC makes for putting people in cloth face coverings or face masks is to reduce their transmissions, reduce the droplets that come out when they speak or breathe or cough. And I think some employers are going to face masks for that, or face shields for that very reason, is trying to, create some kind of barrier from the worker in spreading the virus. However, there's very little data on the effectiveness of cloth face coverings. There is some that suggests that it helps. That's why it's being recommended. I don't know if there's equivalent data on the use of face shields instead of face masks for the same purpose. There was another question in here on KN95, so I'm just trying to find it. These are respirators that are certified under, in this case, the Chinese respirator certification status, some of these imported masks. I don't know if you wanted to speak about what NIOSH has done to look at respirators certified under foreign certification schemas in this case, Scott? If not, I can definitely find the resources to send out in the follow-up email.
Chris, I mean, I guess the only thing I would say is there was information posted. This is on NIOSH's website. Actually, it was updated today. The title of it is NPPTL Respirator Assessments to Support the COVID-19 Response. And it's data that they've taken on a whole wide variety of different respirators, including quite a few respirators from China and other countries, and it compares it provides the maximum and minimum filtration efficiency for each one of those respirators. And so there's, it goes by different manufacturers. So it's pretty extensive, and I think would be very, very helpful for anybody that's using or thinking about using Chinese N95 respirators, because there's a tremendous amount of data, and there's actually a tremendous amount of variation in the numbers. I mean, some of these KN95 respirators have efficiency levels that are like in the 20% range, where other ones are up 90%, 95%, 99% in some cases. So it's kind of all over the map, depending on who the manufacturer was of the respirator.
All right, thank you. And I just found the question in the different chat windows that are in the system that was sent to Jessica privately. The question was use of KN95 masks, is that covered under 1910-134, which is the OSHA respiratory protection standard, and specifically fit testing. And if it is a respirator that's being used and determined being necessary by the employer, I believe that 1910-134 would definitely apply in its entirety. So there are nuances, though, with using respirators that are not certified by NIOSH. Scott alluded to some of them, but there's a lot of information out there on these imported respirators, both from Mexico, China, and Europe, and other places. So it's a pretty complicated issue as far as, how to understand those. I think this question is for Chris. Does Chris have any insight from the research on COVID may impact long-term employment for the remainder of 2020 and for 2021? I mean, Chris, you addressed what your clients are seeing as far as construction starts. Did you have anything to add, or do you feel like you've answered this already? And we may have lost Chris. Okay. With that, I think we're going to wrap up. And Jessica, if you can help us capture any questions that have not been answered so we can try to research them and get them out, we will do so. But I want to thank everyone who's hung in here. We still have over 300 people participating, so I really appreciate you staying more than an hour, and we'll look forward to any follow-up questions you do have, and be on the lookout for our next webinar on this in 2 weeks. Thank you so much. Thank you, Scott.
Thanks a lot. Take care, everybody.